So the journey of being diagnosed with cancer was incredibly confronting. I think the health professionals, the staff need to understand that they see this every day. For me, hopefully, it's a once in a lifetime event.
There will be certain exchanges you have that are really sort of uplifting or just really pleasant, and I think in the context of how you're feeling and where you are, people are having chemotherapy, there's moments that you really cling to that are really warming, and I think it makes a really big difference. And I think it stands out more as well because you do feel quite poor, but you have an interaction with someone that is so genuine or humorous or whatever it is, and it feels really nice. You feel cared for.
Communication is the be-all and end-all. That is the thing that is the most important part. The little smiles, you don't have to even say something to communicate. It's just the facial expressions.
When you're waiting for results and test results and diagnosis, it's very anxiety provoking.
It's been very difficult for me and my husband because we've been waiting a lot, and I know the hospital try to do the best they can.
Nobody was saying, things aren't done quick enough. But I think, again, that transparency about saying, this is when we're going to have the results and this is when we're going to be able to see you, I think that honesty really helps.
I don't want to sit around and wait because I don't know what will happen. His cancer will spread, during the time of waiting. I did want to know what is going on so I can tell my husband, so I can support him. The hospital been very good to us.
Staff remember you, even if it was like 4 years ago or 8 years ago, they still remember you and come up and say, "Oh, hello Glenys, how are you? You're looking well," or whatever. And I think that also makes you feel at ease too.
The initial approach, from the get-go, I suppose, was very calming and accommodating. So they introduced themselves, they took the time. I never felt rushed.
When someone puts the time and the effort into actually sitting with you and actually being present when they're with you, because I know nurses and people that are working in hospitals, they've always got 10, 15 patients at one time. But every time that those two people were with me, they were so present in the moment and really showed that they cared for me as an individual.
If they had been impatient and tried to push me along, there's people waiting, or any of those that suggestions, it would have taken longer, much longer, because all of a sudden your anxiety goes up. You're not hearing, you're not able to follow directions.
I think it is very good when the nurse get into the feeling of the patient and understand what we are going through. It made me feel very good.
I really felt that my oncologist started to know me as a person and I suppose my quirks. So we were in it together in terms of the outcome. I went for a scan and was declared clear. It was high fives. It was quite emotional and completely out of character in a sense for this senior doctor, because I'd not seen her react in this sort of emotional way, and she was genuinely happy for me. That feeling that we had travelled together was there.
Once you've got respect and faith in a doctor or staff or anything like that, it's just like this. You don't have this stress. You just feel much calmer.
As I was going to radiation, she said, "Is everything okay?" And I said, "Yeah, it's fine," because I've got a pretty good poker face. But she saw something different. She saw there was something wrong, and she was like, "No, seriously, there's something wrong. What is it?" And after she asked me 3 times, eventually I let my guard down and I was like, well.
The doctors did their rounds, there's always a lot of them, and then they left, and then 5 minutes or so later the nurse came in that was looking after me and closed the door and just said, "Tess, I don't think you're doing so well, you know, I hope you're okay." And I was like, "Well, I'm not doing so well, I'm, you know, really feeling my mental health's deteriorating." And she said, "Can I give you a hug?" And she did, and it was just wonderful for me. Like, it was just human touch and just so lovely. And she sat and spoke to me for, I don't know, maybe 10 or 15 minutes, and we had a laugh. It was just fantastic. It's what I needed right at that time. She was very in tune. I think I just had that connection with her where she was able to come and be very upfront with me, which is sometimes what people need, like not running around, you know, skirting around the edges. She was just like, "This is what I think. Am I on the right page?" And I was like, "Yes, you are. Thank you."
Well, I think part of effective communication is to pick up on someone's emotional state. If I feel empowered, or I feel I'm being listened to, I'm in control, I'm going to be more relaxed. It makes the interaction easier for the staff member. They're going to get more out of me by just taking that extra couple of seconds at the beginning.
It is easier to communicate with these patients when you know something about his culture. When I speak with people and I say that I was born in Czech Republic, oh, Prague, you know, beautiful city, you know, and like that, and you have almost friend because they react very nicely. Communication between these two sides would be very, very simple and smooth.
It would be good for the staff to have sympathy for other culture, because in some culture, like my culture, we are quieter and we do not ask for more than we receive.
I was meant to be starting a trial, and everything was sort of put in place, and I was sort of prepared to go on it. We'd done all the preparation. And I went to Brisbane for a short holiday, and I sort of planned my flights and everything around it. And the night before I was due to come back, one of the staff members that I knew was involved with the trial but didn't really have much to do with, rang me and sort of said, because of the supplement you're taking, you're not eligible for the trial. We'll be in touch. I felt like I was already had been put out quite greatly, because this trial was, in the context of my treatment, was really important. And I was just sort of told, "No, you're not on it. See you later." And I needed sort of to ask questions or show, well, what about like what's coming up next? And it was just, made to feel like I was a bit of a bother. And then when I finally got onto my oncologist, it was a really sort of awkward conversation, because I think I wanted someone to not apologise either, but just to acknowledge that they had perhaps done something wrong, because I told them from the start that I was on supplements. I can't remember what she said, but she left me feeling like I was a bad patient. And I've only ever had really positive experiences with staff and clinicians, but she made me feel like I was a bad patient and that I wasn't deserving.
Let's talk about my experiences with a young dietitian. I got the lecture, and then it was okay. My weight was going down a little, and I go, sure, but I'm feeling fine. I feel in control. No. I was told I was effectively doing the wrong thing. That I would be hospitalised. I would have a gastric tube, and that it was effectively. I felt like it was a big guilt trip.
Doctors doing their rounds in the morning, of course, have to cover a lot of patients, and when they have students, they will be outside the room or just a bit away explaining everything to that student of what's going on. But I felt that if they did that in front of the patient, I mean, it wasn't as if I couldn't hear them outside the room, as if they did that with the patient, in my case, I would have felt more included. I personally believe that I should have been the learning tool for the students, so I should have been the priority.
I was unwell for quite a lengthy time, maybe 9 or 10 days, and I had very high temperatures and I was hallucinating and I was not doing so well, and I was in an isolated room and I had many doctors coming and going, and it was stressful for me, my family, and I think very stressful for the doctors. They couldn't work out what was going on, and I felt in all of that, that often they would come and not talk to me or talk to each other around the bed, and I just felt like I was not there. Although they might not have got anything good out of me because I was quite unwell, but it would have been good for them to consult with me and ask me.
My specialist that I met with initially and then during the whole process through my treatment, and this particular specialist, he was very good at addressing me, but when I had my partner with me or my dad with me or any of my family members, he never used to greet them. I didn't know why, maybe because I was his patient and he was focusing on me, but at the same time I also want my family is going through this just as much as I'm going through this. So it would have been nice if he addressed them and included them as part of my journey and my treatment as well.
If the carers are upset, the patient's going to be upset as well.
Carers, family have got a lot to deal with as well as the patient. And sometimes, I know Alan, he's my rock.
You don't know what's going to happen. It's hard.
I was in hospital at Christmas time and one of the big senior doctors was doing the rounds, and I hadn't met him before. I knew who he was because he's, quite famous here. And he came in and he sat on the bed and he held my hand and I was like, oh, what a lovely person, it just really made all the difference to me. And sat and talked to me for 10 minutes, not about my cancer, just about life and what I do for a living and when do I think I'll get back to work. It was just really, really good. I didn't want him to leave. I felt like he really cared. It really did. Although I'd never met him, he knew about me. He'd obviously taken the time to, read up on my file. We talked about how I was for 2 minutes with the cancer, but the rest of it was just very human and very real. And he was like, I'm really sorry that you have to be here, but, we're going to get you well. And, it was just really, really wonderful.
Even when there was a bunch of doctors, the most senior doctor would kind of sit on the bed or sit on the chair or make the effort to go and bring a chair round and kind of sit up and say, how's it all going, and let's actually talk about this as a conversation rather than me just kind of telling you what I think and, then speaking to my buddy next to me.
It's very important that particularly the doctors give you the opportunity to ask questions and that they're happy to answer the questions.
It'd be really good if you're always consulted because you are, you do have feelings, you're a human, you're not just a number or a person in a bed.
I think everybody has different levels of information that they want at different times as well. Sometimes people want written out lots of information, they want all their questions answered, they want, give it all to me. Whereas sometimes you don't want that much information, you're like, look, just tell me what I need to know for today, and then I'll come back and I just can only deal with this. I think once you ask somebody, it gives them the opportunity to actually help control what's going on and control the information that they have as well. The clinician that we were seeing made the effort to assess Mum's information needs, to assess who she was, to assess the best way to deliver that information, and I think that was really effective.
To make a leap of faith, the system is going to look after me or this professional is going to look after me, I need them to show me some data, and that came very much from the senior oncologist again, showing me the scans and the reports and the results very graphically in a way that I could understand them.
So quite often after the doctors would do their rounds and the nurse was finished with her patients, the nurse would come back to me and ask if I understood, or quite often I would have written down quite a few questions actually, because I would misinterpret things, or I would sometimes hear what I wanted to hear, which is getting out of hospital, but the nurse would clarify that we need to get to this stage with bloods or this stage before you can get out of hospital, which is what I needed. I feel like they went out of their way to do that, to make sure that we understood.
These nurses were wonderful in the ward. They really were very helpful and explained me everything, and also doctors. So they give me confidence.
It's vital that the information gets across clearly and the patient has the best set of information that they can work with. Because there's been plenty of times I've been to appointments and things, and I've spoken to doctors and they've said something and we've not really understood, and then we've gone away, and then you feel a bit anxious because you don't really understand what's happening. So I think, yeah, it's really, really important that staff can communicate clearly, and I just think a good way of sort of ensuring that is that if a staff member can walk away and say to themselves, yes, that patient understands what I've just said.
I need to know that the person treating me actually sees me as Simon the person.
To be non-judgmental, you've got to consider what the person's going through.
I think having a laugh is so important, For me, it's either, if you have a laugh, you lift your spirits.
Most patients in this centre are going through an experience that they've never gone through before. Staff members smiling and saying, how are you going, how are you feeling, saying good morning makes a huge difference.
The key message is really that it's important to assess the individual needs and the current situation of where a patient is.
It's probably the best advice I can give staff is trust your patient.
It's very good when the nurse gets the feeling of the patient.
I'm quite friendly with a lot of the ladies in radiotherapy, and that just makes such a huge difference to have that relationship where they genuinely care.
Advice I give to staff is to express kindness.
As long as you have compassionate and caring people, the journey is not so long.